All righty. Good evening, everybody joining us. We are now live on Facebook and live on our Zoom webinar. My name is Dr. Cristina Pardo, and thank you for joining us for the SUNY Downstate Community Women's Health, our first virtual program. I know it's a rainy evening, and hopefully we'll share some good information. This group that was put together as part of the Department of Obstetrics and Gynecology, we're here to reach out to our community, to reach out to all of you out there. We know it's been a difficult time for everybody. We're not able to reach out to our healthcare providers as usual. We hear all the questions, we hear all the concerns. So we're here to hopefully answer some questions, have a dialogue, and this will be the first of many. And as I said, we're here for you. And I am very excited to have with us as my co-moderator, Roxy from 93.5 FM, Irie Jam Radio, and I'll just do a brief introduction for her. Roxy, as it says on 93.5 FM. She's also an adjunct professor at Iona College in New Rochelle. She's currently a doctoral student at St. John's. She goes past that. She uses her platform and powerful voice to inspire others. She's co-founded an initiative called No Disrespect Campaign, for which she received a citation from Brooklyn Borough President Eric Adams. Growing up in a strict Caribbean household, she proudly embraces her culture, and happy to say that we have, nobody can't hear me. Maybe move closer. Hopefully my volume is a little bit better. Thankfully, recently we've collaborated on the ICU La Toujours program, and she answered the call quickly to help us with that. And she again answered the call to work with us on this program. So with that, Roxy, thank you and welcome joining us this evening.
Welcome everyone. Thank you. Can you all hear me? Hopefully you can. If not, just as Chelsea Grant did right there, one of our attendees, just let us know in the chat section. I'm excited to once again work with Dr. Pardo, this time on women's health, and really focus on what's going on, especially during this pandemic. We'll be speaking on a lot of topics tonight that will, I'm pretty sure, be of all interest to you. We'll be touching on everything from routine care to fibroids to postpartum, labor and delivery, and of course, mental health awareness. And we have some amazing panelists on this panel tonight. Please share if you still have women or close friends or people that you know that want to discuss any of these topics. You still have time to let them know and share the information, as this tonight is a free event. And I'd like to thank once again, Dr. Pardo, thank you for getting me involved in this, and thank you to all of the panelists that I got to know this week and we will be enjoying tonight.
Thank you. And so just to start off with some housekeeping, we are doing this on 2 platforms, on Zoom, webinar, and Facebook Live. Both have the ability to have some interaction, so please send us questions, send us comments as we're going. Whatever we don't answer now, we're going to integrate and make sure that we answer and even put together some frequently asked questions. So please let us know. We also have an email address, womenshealth@downstate.edu, and you can email us there anytime, and follow Downstate on social media. I want to make sure we thank our Department of Obstetrics and Gynecology for supporting us in this initiative. Our chairman, Dr. Minkoff, our director, Dr. Lee, another one of our partners in crime is Gladys Christoph, who is not joining us this week, but for all our Haitian community, we are going to have notre programme semaine prochaine pour femmes haïtiennes, le 19 juin, and Ms. Gladys Christoph will be joining us for that. And before we start, I wanted to make sure we took a moment to acknowledge all that is happening in society right now in our country, with the injustice against people of color throughout the world. We know that racism affects us not just as we are seeing on display, but also within our health and healthcare. And all of us here are advocates for our communities, and we'll do our job to bring equity to our communities. So with that, Barbara, if you can, start us off for the evening.
Yes, so at this moment in time, just to remind everybody, you will be on mute, and questions are always encouraged. And of course, that's what we have the chat section for. I'll be moderating that section as well as Dr. Pardo. And of course, by 6:45, between 6:45 and 6:50, we will be taking those questions. And just in reference of time, we just want to keep everything succinct and have 5 minutes for those questions and answers. But without further ado, we're going to introduce, or let the panelists introduce themselves. I'm going to run down the names. We have Ms. Faith Cornwall. She is a midwife. We have Dr. Oyanike Kalanko, Dr. Joanne Hsu, and Dr. Lauren Grotel, and of course, Dr. Cristina Pardo. Now, Dr. Faith Cornwall, you can go first.
Oh, hi, good afternoon all. Thank you for joining us at this webinar. We are very excited to do it. My name is Faith Cornwall, and I am one of the 2 midwives at Downstate Medical Center. I've been there for the past 16 years or so, and I must mention my other partner, midwifery partner, Ms. Christoph. She's also been there about 16, 17 years, and as you heard Dr. Pardo say, she's going to be joining us at another webinar later on in the week or maybe next week. I'm very excited to serve the population that I am serving. Being an immigrant myself, I hail from the Republic of Trinidad and Tobago, and it excites me, and it's quite an honor to give back to this population. I did my midwifery at Downstate Medical Center, and it's beautiful to learn something and then be able to return there to serve and to share that education. So once again, I'm thankful to be here, and I'm open and willing to anyone contacting me for questions or so.
Can't hear.
Dr. Kalanko.
Here I am. Yes, how are you? Hi, this is Dr. Kalanko. I am one of the attendings that attends the patient in the Sweet Tea Clinic. I've been with Downstate for over 9 years now. I am happy to be in the community which I grew up in. I'm actually born in Greenpoint, Brooklyn, raised between East Flatbush and Canarsie. I see a lot of my patients even in the shopping, when I show shopping. And like Ms. Cornwall said, I'm really dedicated to the community. I believe in the community and grassroots. Recently working in Brownsville and East New York area. And I think that, given what's on the agenda tonight, that our community is going to gain a lot from this. And I look forward to having other occasions to share in this kind of format.
Great, thank you. How about Dr. Grotel?
Hi, everybody. I'm Dr. Lauren Grotel. I was also born and bred in Brooklyn, New York, as were my parents and my grandparents, and probably my great-grandparents, to be perfectly honest. I am a student of Downstate, so I got my MD degree from Downstate here, and then I went out to Long Island to what's known as the Downstate of Long Island, Nassau University Medical Center, and missed my patient population in Brooklyn, so I came back to be an attending, and I'm happy to be here.
Dr. Hsu.
Hello, everybody. I'm Dr. Joanne Hsu. It seems like, unlike everybody else here, I am actually not from Brooklyn. I grew up in Texas. I came to New York to work and train at Downstate as an OBGYN, and I've been here for just about 5 years now, always in Central Brooklyn, serving the women of Central Brooklyn. Very excited to be here and do what I can to help. One thing that I feel like I do have in common with a lot of the patients I see is that as many of my patients I am also an immigrant, so I feel like we have, even though I may not necessarily be from Brooklyn, there is some sort of connection as there, as well as somebody who was not from this country originally.
Thank you. And I don't know, our Roxy, are you? I think we're having some IT difficulties. Are you able to hear us? Can you talk in?
Can you hear me?
Yes, now we can hear you.
Okay. So thank you, Dr. Shu. Are you going to do the open question, Cristina, or would you like me to do that and then?
Sure,
continue?
I will, and I guess I'll round out by saying, Doctor, for those that don't know me, I'm Dr. Cristina Pardo. I am also not originally from Brooklyn. Grew up, I'm Queens and Long Island by way of Haiti, but love working in Brooklyn, love working and serving our underserved and immigrant and vibrant community, and reaching out and being able to connect with all of you is part of what I love, what all of us love here. And with that, we will start with our first question, actually, for Ms. Cornwall and Dr. Kalanko. We know that the past couple months has been difficult for everybody. It's been a time of change as a result of coronavirus. Many things in healthcare were put on pause, but there's one thing that can't pause, and that's pregnancy. And we had to make sure we find the best ways to take care of our patients. And you guys were on part of that front line for us, at Downstate. If you can share some of your, observations during that time period amongst the women that we served, and how we adjusted prenatal care during that time, and what we're doing now as it relates to prenatal care as we're in a recovery time period.
I can start. I'll say first and foremost, our patients' welfare and their children, expected children, were top priority for us. From hand washing to sanitizing the rooms, we tried our best to ameliorate what we could. But COVID was a beast, and we eventually know that we were going to close for a while, Sweet G, given the orders from the state. But before that time, the effort was very valiant in trying to keep our patients safe, distancing them, getting them in and out as much as possible. But like you said, pregnancy can't pause. And coming back when we were relocated to Lefferts, definitely a lot of patients missed a lot of visits, some tests. We had to play catch up with a lot of patients as if they were coming to us for the first time. And I could feel the tension sometimes from the patients who were trying to make appointments or who are just plain scared about getting COVID and being ill with their child. And that's a normal response for anybody, especially a pregnant woman. Our defense is, we defend our children in the womb. So I think it was a very humbling experience for me. And, personally, I did contract COVID-19 and I was ill for a while. So to have empathy is beyond. I actually could see what they were afraid of and fortunately lived through it. And I continue to be very vigilant with my patients. We're wearing masks, we're wiping down tables, and we're just trying to practice the social distancing with our waiting area and in our exam rooms as much as possible.
Great, thank you. How about Ms. Cornwall? Anything that you want to share from that experience?
Yeah, well, the pandemic really did a number on us as professionals, as providers, and also on the patients. They were scattered. We were kind of scattered also, but they were scattered. Downstate became a COVID-only designated hospital, and that put the fear of Jesus in our patients. They wouldn't come anywhere close. So we had to actually try and call them to encourage them. We made some arrangements where we were able to see some of our patients at another clinic, as Dr. Kalanko mentioned. But we can only see the OB patients and we can only see them for a number of days in the week. So it was really very hectic on us. It took a toll on the patients. And also with the quarantine, we had a lot of patients staying home, gaining weight, not exercising, being afraid, losing their minds. And unfortunately, some of our pregnant patients succumb to losing family members. So they had a lot of more to deal with. They had to cope with grief. Their extended families, the grandmas, the grandpas, the nannies who passed really turned their world upside down even more because, as you know, in this population, we depend heavily on the extended family. So it really did a number on our patients, but we were able to keep in contact with them.
Yeah,
even our
Yeah, and I will say, and I'll add, we can only, speak for our own experiences, but I know like many institutions made all, the appropriate arrangements to provide all necessary care. Telemedicine, we actively outreach to all our patients and provide all the support that we can throughout that time period and the following, because it certainly was difficult for everybody, but we know that all institutions,
Right.
just like our own, went the extra mile in this time where we had to do the best that we could. So now, Barbara, onto our
Next topic. I just wanted to say a huge thank you to both Faith Cornwall and Dr. Kalanko, especially Dr. Kalanko, you sharing your COVID-19 experience. I know a lot of people have worried about that with our healthcare workers. So again, thank you both for your service. We're going to move right along to the next topic, which will be on delivery and postpartum post-COVID. So let's talk about labor and delivery with Dr. Grotel. Dr. Grotel, can you please tell us a little about what women can expect when they're delivering and postpartum in this post-COVID time? I'm asking this as well because I know a lot of my friends who just got pregnant, and one of my friends this week who just delivered her baby boy and was lucky enough to have her husband in the room with her. So can you talk a little bit about that?
Yes, hi. So we are fortunate enough to be able to reopen our labor and delivery and our postpartum units here at SUNY Downstate. As you've seen in some of the press releases, we were able to open as of June 1st. So what you can expect when coming to our unit is you will first be put in the triage, where you will be checked for COVID-19 with a swab, just like in any other hospital, especially in the New York City area. And then you will be given a mask. We have been following strict CDC guidelines and also the guidelines of the governor, along with the other hospitals of Brooklyn and New York City, to allow you to have a partner with you during labor. And here at Downstate, we are also allowing a doula to be with you during your labor process. Postpartum, your partner will be able to stay with you as well, with limited ability to leave and come back. So it is important that your partner pack a bag and bring snacks. So another thing that's important is to remember that during breastfeeding, if you are found to be COVID positive, to wear a mask, and also to still continue to practice those precautions with your hand washing and things of that nature.
Yeah, all of those were really, really great points. And I want to, the reason why all of these measures are happening, like the distancing and why the mask for even the support person is to keep everybody safe. So we're still, coronavirus is not entirely passed. So all Downstate, just like all institutions, are taking all precautions to keep everybody safe, making sure we're cleaning surfaces, making sure people are able to practice distancing, making sure that everybody has some protective equipment. And I think maybe we can take a little bit more time to go talk a little bit more about breastfeeding. I know Dr. Kalanko, when we were preparing for this, is something that you reminded us that is important that we bring up today.
Yeah, I think breastfeeding is a very important part of the bond that a mother makes with her child, and nutritional wise. In our communities, it's not as popular as it should be. Those of us who come from immigrant backgrounds, like myself from Nigeria, where breastfeeding is much more expected. I do feel like here it's not as expected, but we can't deter our patients from doing it. Even with COVID, we have to take precautions. You know, breastfeeding reduces sudden infant death syndrome that's high in our communities. It reduces diabetes. It reduces, it increases their ability to fight infections. So that is not something we want our patients to do away with. And for our patients who do get care at Downstate, if they need it, we do order a pump at the time before they deliver, so they have a breast pump available to them if they're going to go back to work to store their milk. And like I said, I support it. I've started programs for it, and I hope that is something that the patients, if they have questions, that will be able to avail them to keep that supply of milk going.
And one thing I'd like to add about the breastfeeding, so even specifically by the CDC, specifically that even if you are coronavirus positive, that determination of whether you breastfeed is determined by the mother, and of course in coordination with the family and healthcare providers, but making sure to take proper precautions. So if you choose to breastfeed, wear a mask, making sure that you are cleaning. If you're using a pump, using proper cleaning recommendations. And again, you can reach out to whoever your healthcare provider is, or come ask us, or come and see us, and we can provide more guidelines about that.
Yes, and we do have a quick question for Dr. Grotel. It comes from one of our attendees. It is, do the doulas and partners have to take a COVID test when they come to the hospital for labor and delivery?
So Deborah, thank you for your question. As of now, no. Partners and doulas are not subject to the COVID test. It is only the patient who is being admitted to the labor and delivery floor. However, this is subject to change depending upon CDC and New York Department of Health guidelines.
But everybody is screened for symptoms, though, to make sure there are not symptoms of coronavirus. And I guess to close out on coronavirus, we are fortunate, as Ms. Cornwall said, Downstate did answer the call of the state and was a coronavirus only facility, and some of us helped with other services. I was an emergency room doctor for a day, and two of my colleagues here on the screen, Dr. Grotel and Dr. Shu, actually ran a coronavirus service. So OBGYN, and they did an amazing job. So if they can share with us a little bit, because it's still important, about coronavirus, the important points, prevention, anything that's important for our audience to know.
Thank you very much, Dr. Pardo. Like Dr. Pardo said, myself and Dr. Grotel, we spent most of the month of April not as OBGYNs like we thought we would be doing, but we actually joined the internal medicine services to take care of men, women, adults of all ages with COVID, who were the hundreds that were admitted to Downstate during the height of the pandemic. As many of you may know by now, COVID is a viral respiratory illness, although most of the symptoms are kind of the things you associate with respiratory illnesses, like coughing, fever, chills, etc. There are a lot of people who have this and don't actually have any symptoms at all. And there are some people who have nausea, vomiting, diarrhea, some GI symptomatology as well. You know, this can maybe be a little bit more rare. A lot of, even in the early days of COVID, a lot of the problems we were facing were shortages of testing. However, we're lucky now that the testing supplies are significantly more. I know that a lot of urgent care centers and clinics are doing walk-in COVID testing, and a lot of the times this is free. So if you want to know what your COVID status is, or to do an antibody test, the antibody test can tell you if you've had it in the past. There are definitely a lot of resources in the community to get tested at this point in New York City. Like we've been able to make that change, and testing is a lot more available. I don't know if Dr. Grotel wanted to add anything.
Shu covered it all. I think we're good.
All right, well, perfect. Thank you, Dr. Shu, Dr. Grotel. As we enter phase one of what we call after COVID, post-COVID, and we're getting back into our routines, a lot of people are thinking about things that they should get done. For example, annual examinations. So many women are concerned about missing these. So Dr. Kolenko, can you share with us what guidance should women follow in general? And Dr. Shu, I know that you could focus on cervical cancer screening and prevention. If you could share with us some information and guidance for that during and post-COVID.
Well, we have to definitely recognize that routine is no longer routine anymore. And
Right.
our first thought is that we don't want patients to be unnecessarily exposed to an environment that they don't have to be in. So like Dr. Pardo said, we are actively trying to put on, get our telemedicine up and running. So that can act as a triage for our patients to know how they can manipulate the system, whether they should come, not come, what have you, at least get medical direction. Definitely there's some conditions that you can't stay home for. If you have pelvic pain and fever, definitely you need to seek help. And there are definitely other conditions like ruling out ectopic pregnancies. That's something you can't do in the house. So, we are all, treading in, uncharted waters when it comes to this. And at the end of the day, I would never tell a patient, don't come, because the risk that you take staying home sometimes not worth it. And I know for myself, I worry about my patients who their education and their health literacy might not be the best. So, we're going to work together. Like Dr. Pardo said, we're giving our patients masks. We're giving their family masks if they come with them. And we're going to work together to get the best solution. Me personally, I do call my patients back after I see them with their results so that they don't have to come back to the hospital. And I hope that helps to diminish their exposure. But definitely this is something that's going to be a patient by patient, situation by situation, circumstance by circumstance evaluation. It's not going to be a cookie cutter situation for everyone.
Right. Thank you.
So,
Dr. Shu?
real quick on pap smears. Everybody's heard of these before. It's one of the things that everybody talks about for the Well Woman exam. Just to go over things briefly, the pap is a test that can help prevent cervical cancer, to detect the early precancerous changes that can go on in the cervix before it turns into cervical cancer eventually down the line. Dr. Pardo, I think you have a graphic of the tools that we use for a pap smear. A lot of the women I see have a lot of anxiety about getting the pap done because, as women, we know pap smears, pelvic exams just are not the most comfortable thing in the world.
Showing the graphic now on the screen.
You can see the cervix halfway down the graphic. The cervix is really the entrance of the uterus and is accessible through the vagina, which is why we usually do our pelvic exams. Can you go to the next the tools graphic, Dr. Pardo? These are the tools that we use to do pap smear. As you see, there's nothing sharp. We're not going to do anything cutting, scraping, etc. There's a soft little round brush you see in the back with a blue handle, and then the white piece in the front is kind of a soft plastic-like spatula. So once we see the cervix, we use these to gently collect some cells, send it to the lab, test it for HPV, and test it for cell abnormalities. Even though a lot of women have traditionally learned that you have to get a pap every single year, this actually might not be true, depending on your personal history, and also depending on your age. If you've had abnormal pap smears in the past, you might actually have to get them a little bit more often. But if you're someone who has been getting pap smears regularly in the past and they've always been normal, you've always been on time getting them, sometimes you don't have to get them until every 3 years or even every 5 years. Of course, it can be a little hard to remember sometimes when you're due for one, and that's where we come into play to remind you. If your regular OB/GYN exam has been delayed recently because of COVID, it's always a good idea to get in touch with your regular gynecologist to see if you might be due for pap smear. It's not an absolute emergency that a PAP has to be done immediately, but it's good to, generally try to stay on schedule for this test. And of course, if we've done your PAP in the past, we'll let you know when you're due and when you have to come in.
Thank you so much, Dr. Shu. Thank you so much, Dr. Kalenko.
That was all, perfect information. I want to make sure we reiterate, as Dr. Kalenko said, if you have to be seen, that we'll always make sure that we create that space for anybody that needs to be seen in the office, as most healthcare providers would. And they're always still within gynecology emergencies where, as Dr. Kalenko said, that it's important to be seen. And please don't be afraid of accessing healthcare. So going along those lines, I think we touch on it a little bit. Healthcare is changing after this, post-COVID or in this recovery phase. We're doing a lot of things virtually, as we're doing now, this town hall, and we're doing a lot of that within healthcare. So if Dr. Shu, you can talk to us a little bit about those changes and where that we integrate that within women's healthcare.
So I've been tasked with bringing telemedicine into OBGYN at SUNY Downstate, which is something that I've been really excited about. Telemedicine is the use of video and audio together to let a patient and healthcare provider communicate. The rest of us have been doing this for years with FaceTime and Skype, etc. But as things tend to come a little slowly to medicine, we're just starting to catch on. Basically, you're just essentially video chatting with a healthcare provider instead of seeing them in clinic. Now, telemedicine has been a part of some medical practice for a few years, but it's been mainly used in more rural areas or in situations where it's really difficult for the provider and the patient to physically come together. But like a lot of other things that have changed really quickly with COVID, the last few months have really shown us how much we can use telemedicine, how much telemedicine can do. For example, in OBGYN for prenatal care, a lot of people are starting to alternate in-person appointments with telemedicine visits. For example, if we just need to check that your blood pressure is okay, we can do that over telemedicine. If we need to check to see your blood sugar is okay, that's also something that can be done via telemedicine. And that's something that we're ramping up to do at SUNY Downstate OBGYN as well. And for the non-pregnancy visits, if we have, for example, if I've prescribed you medication, I just need to check in saying, hey, is it working? Is everything going well? Are we going to continue it? That's absolutely something that we can talk about over like a video format. Or a lot of birth control prescriptions can also be managed via telemedicine and don't necessarily need an exam. We just need to have a good talk about, the side effects, what the risks are, what kind of things to watch out for, and you don't have to come to the office to do this kind of visit, even though I would like to, have some time to sit down and chat. Like Dr. Kalenko said, there are still many things that we still need an in-person visit for, like I was just talking about earlier with a pap smear. Unfortunately, we can't do that over video chat quite yet. And some things like if you have pelvic pain, I need to do an exam to see what's hurting, if anything feels abnormal, and I, am not able to do that virtually. But one really great thing about telemedicine, I think, is if you're really not sure if you should come in, or you're trying to figure out how much concern you should have over something, talk to your doctor over telemedicine. If it sounds like something that needs a little bit more evaluation, we can definitely schedule for somebody to come in to see us after we've had that initial telemedicine chat. Or if it's just like, hey, I want to get on some birth control, great, you give your prescription there too. In general in medicine, as well as specifically in OB/GYN, I think telemedicine is something that's here to stay after it's really ramped up during this COVID era, which I think is such an exciting thing because we know how difficult it can be to come in to see the doctor sometimes, especially if you're busy with work or school or children, and you just want to review some results or have a conversation about what's going on. So telemedicine allows us to start your care from your home or wherever you're located. And just see from there if you can take care of things remotely, or if you need to come in for an exam, etc.
Thank you. And as we said in the past couple of months, many women were not able to see their gynecologist as planned, even though some of their problems or concerns persisted. So I know, especially for women of color, fibroids is something many women deal with. So Dr. Pardo, can you talk to us about fibroids and options for taking care of them?
Sure. And I'll start by saying, you know, yesterday, some of my cousins, they told me specifically that they're watching because fibroids was on the flyer. So fibroids is something we hear a lot about. It's something that certainly affects our community and causes a lot of distress. And just like pregnancy is not going to pause, any symptoms that we are feeling, and actually I wanted to make sure that we mentioned telemedicine is good not just for birth control, but menopause, if you're having menopause symptoms, and seeing what we can appropriately do during this time period. So just like pregnancy is not on pause, any gynecologic symptoms that we have related to fibroids are not on pause. And this is something we received a lot of questions about. And I will return to our images from before and because usually when we're in the office, oftentimes many of us will draw a uterus to describe what fibroids are. So I thought this would be helpful. Fibroids are benign growth, benign meaning that they're not cancer, that grows within the wall of the uterus, within the muscle. And they can be in different places, on the outside, in the middle of the wall, or pointing towards the inside, which is where we have our period from. And depending on where they are and the size depends on what symptoms that we have, whether you have pain, whether you feel like your belly has gotten bigger, or whether you have a lot of bleeding. And again, depending on the symptoms that you have, whatever treatment that we prescribe may or may not be effective. So there are medical options, medications like birth control, other type of hormones, and other medication that we can use to try to help with pain and or bleeding. Again, depending on the size and where the fibroids are, they may not be as effective. Or they may work great for you. Unfortunately, it's not going to be the same for every woman. There are less invasive surgical procedures that can be used for the fibroids as well, going up to surgery, either removing the fibroid, or if you are finished having children, if you're at that stage of your life, removing of the actual uterus can happen. Now, obviously, we know in the past couple of months that we have put a pause on elective surgeries, meaning surgeries that are not required in emergent situations, meaning it's not a life-threatening concern for at that time. So many women with fibroids may not have been able to have procedures that they normally would have in that time. You can speak to your provider and try one of the medical therapies to kind of hold you off during that time period until you are able to safely have surgery. And again, the pause on surgery is to keep everybody safe because of how much of coronavirus was there, the exposure to patients, exposure to ourselves, and making sure that we had the equipment that we needed for those that were suffering from coronavirus. So for fibroids, there are a wide array of options that are there. There are medical management that usually can at least take care of things in the short term, like may have been needed in the past a couple weeks until surgical centers are able to do surgical procedures if that is something that you want to pursue.
Right. Thank you so much, Dr. Pardo. At this time, we're going to go to our last topic, which is just as important. So far we've spoken on routine care, women's health post-COVID, COVID-19 in general, fibroids, and labor and delivery. We are now going to flip the switch and talk about mental health awareness. I had shared this week, actually yesterday, that unfortunately I lost a colleague and friend to suicide. Mental health has been plaguing us for such a long time. And it is very important to talk about as, you know, our climate, our environment is shifting, and to see situations and solutions where we can prevent something like this, and have a forum or a place to go to talk. And right now I'm asking between Ms. Cornwall and Dr. Grotel, what do you recommend for staying well in general? And during what has been such a difficult time for so many people, there are people dealing with mental health issues and having to stay in the home. So Ms. Cornwall, if you could directly discuss general wellness, maybe exercise and coping with relief and stress. And Dr. Grotel, if you can speak to the mental health, wellness, bringing up domestic violence and resources. Ms. Cornwall, you can go first.
Okay, thank you so much. With regard to the pregnant woman, we would encourage patients to utilize what you have. You don't have to invest in expensive gadgets or gyms. Use your home. I usually recommend that patients turn the TV on, so their favorite movies, and walk on the spot. Use something as spaghetti sauce or canned foods as your light weights, and move your hands while you're moving, while you're walking on the spot. Dancing is also an excellent source of lifting or releasing endorphins to make you feel happy, and that also helps you to relax. Things like using diffusers with lavender essential oils or other types of oils that you may like is very helpful. Foot baths, hot foot baths, warm foot baths using Epsom salt. That gives you a time to pause, it detoxes you also, and it also helps to relax you. Laughter. It's very difficult to find something funny in these times, but laughter also helps to release endorphins, which improves one's moods. Mindful breathing, where you breathe in and out deeply. You can breathe in while counting to 5, hold it for a count of 5, and release those breaths for a count of 5. And that helps to slow you down. It helps to help you to relax also. And as you get better at doing it, you can increase your counting from 5 to 7 possibly. And one of the things I really encourage, if you believe in God, in a supreme being, connect with that deity. Go back. If you've been missing, that's okay. There's always an opportunity for us to, to relate. And also for those who've had losses like yourself, allow yourself to grieve healthy. It's very important to cope with the stresses that's going on around us. But it's also, there's a way to cope, there's a way to grieve. And if you're not grieving healthily, it can lead to depression, it can lead to suicidal ideations. So if you feel that you've had a loss, feel free to ask your provider for a referral to a therapist, a social worker, or some professional person who can help you during this time.
Thank you, Ms. Cornwall. Dr. Grotel?
Hi. So we have actually seen, we don't have the exact numbers yet as the data is still being collected, but we have seen an uptick in domestic violence and suicide during the time of COVID because of the isolation that people are feeling and are being forced to stay in. One of the most important things is to recognize when you do feel those feelings and try and reach out to your loved ones. The use of FaceTime, even phone calls, can be very helpful at this time. I know my grandmother, who's 90 years old, does not have FaceTime, but we try and call her at least once a day to make sure that we maintain that contact because she is at home alone. Dr. Pardo luckily did put together some slides for us about the contacts that we have here in Brooklyn to help during this time. So with postpartum depression, a very important thing is to look for some changes in the way that you're feeling about the baby or the way that you're feeling about your care of the baby. Sometimes it's not necessarily the baby that is what's evoking these feelings of sadness, but it's your feeling that you're unable to care for your child. So really thinking about how it is that you are maintaining your self-care, and also the care of your child can help mitigate some of those feelings. It is really secondary to hormonal changes, some psychological adjustment. You do have this new baby that relies very heavily on you, and also fatigue. I was a new mother once, and I don't think I slept for 3 weeks. So it is definitely something that can happen. So first you want to speak with your partner, your family, or people you trust, such as friends, or your doctor, of course. You can call 311 and you can say your exact neighborhood so that they can give you exact numbers. There is also a general number that you can use, 188-NYC-WELL, W-E-L-L. This is free, it's confidential, and they're open 24/7. And if you think you are having a real emergency, please call 911. Mental health emergencies are just like physical health emergencies, and they should be dealt with at the time of the incident. So if you or somebody you know is being hurt or you feel unsafe, there are resources that can help you. The New York City Domestic Violence Hotline is 1-800-621-4673. Okay, that's a number that's important that you should have in your phone, and so that you can give it to others if they need it as well.
Thank you so much, Dr. Patel. Thank you.
That was a really great information shared by Ms. Cornwall and Dr. Patel. And I think it's safe to say that all women, I mean, everybody has, this has been a difficult time for everybody, whether you've had those who you've lost around you or just adjusting to the isolation during quarantine time. So we really felt that was important to discuss this evening. So I think now we've gotten a couple questions both in the webinar and on the Facebook Live, and we will address some of them now. And as I said before, if we're not able to address everything, we're going to keep everything and make sure that we're addressing all the common questions that people are giving us. We have responded to some of them on the webinar, so I want to make sure that we answer any that may be on the Facebook Live. And the first, and this would be for Dr. Shu. Telemedicine is great, but getting appointments to have Nexplanon removed, well, I guess it's not nice telemedicine, but I already called it a name. But she said would have Nexplanon removed is difficult. What do you recommend? I guess, is this something, where do we categorize that in this time period? And what do you recommend between now and, I guess, when you're able to get an appointment for Nexplanon? And I guess for those who don't know what Nexplanon is, maybe just say a little bit what Nexplanon is.
So Nexplanon is a birth control device that we consider a long-acting reversible contraceptive. Long-acting because it's not like taking the pill, you take one pill, the next day you got to take another pill. Nexplanon can stay for a couple of years actually and work continuously during that time. Reversible because once it's removed, you can go back and have babies. It's not like getting your tubes tied. It's kind of the size of, it's a little plastic thing that's kind of the size of a matchstick and actually goes in your arm, just right here under the skin. It kind of feels like you can feel your bones under your skin and you know it's there. And what a Nexplanon feels like. If you have one in, you can kind of feel the little plastic piece under here. Now, when a Nexplanon is done working, when you've hit your maximum number of years, we recommend that you take it out, whether or not you replace it with another Nexplanon, you move on to another kind of birth control device, or you want to have a child. Leaving a Nexplanon in for a couple of months after it's due to come out isn't going to be harmful. Of course, I don't recommend leaving in for years at a time afterwards. But if you cannot immediately get an appointment to take out your Nexplanon, I wouldn't worry too much about it. It is really important after when you're like, if say your next model is due to come out in end of April, and you don't get it taken out till July, that's fine. But starting at the end of April is really important to keep in mind that you have to use another form of birth control. Because even though it's still in there, it just may not be as effective after whatever, like the date that it's supposed to come out on. If your doctor is looking a little slow right now, as we are, just to kind of keep the appointments spaced out, I wouldn't worry too much about not having it removed for a couple of months. It's not going to do you any harm. But again, use that backup form of birth control. Dr. Pardo, you did say telemedicine, so I am going to use the opportunity to jump on a question that I had in the Zoom webinar right here. Sorry, let me just scroll up here. Ms. Gabrielle Janti says that in terms of women's health, do we have to have a face-to-face visit before initiating telemedicine, or do we need telemedicine to follow, or do we only use telemedicine to follow up care? There are a lot of practices that right now are offering telemedicine as an initial visit. This is kind of a legal thing as well. Some states say that it can only be used as follow-up. New York State actually says that you can establish a relationship with your healthcare provider and see an initial visit via telemedicine. This is something that we're still rolling out from Downstate. So stay tuned, and you may be able to book like an initial GYN visit to discuss an issue with soon.
Awesome. Thank you, Dr. Shu. There's also a comment in the chat from Deborah. She says, I work with women who have stated that because of the pandemic, they're afraid to go to the doctor or hospital at this time. How do you appease people who have thoughts like these?
Yes, so we found that very common, especially when we were working on the COVID teams, that we would see a downtrend in the patients who were coming into the hospital. Luckily, we have now been denoted as no longer a COVID-only hospital. So we are open to all patients and to all visitors as of now. So what we can do is make sure that you are taking the same precautions when you go to the doctor as you do when you go to the grocery store. So make sure that you are wearing a mask, make sure that you have sanitizer. If you don't have sanitizer, every doctor's office and hospital will have sanitizer provided for you. And we can also provide you with masks, as Dr. Shu had mentioned prior in one of her answers, if you do not come with one. It is important that you continue to use the same precautions with going to the doctor. We do not want you to forego care so that because of your fear of COVID. If you practice those precautions, your likelihood of getting the coronavirus is much lower.
And
Thank you.
I'll also add that, all healthcare facilities are really taking this, seriously and following guidelines to keep all of you and us, the healthcare professionals, safe as well, meaning to making sure surfaces are being cleaned, appointments are being staggered in certain ways so that waiting rooms are not overfilled. That's part of the reason why the telemedicine is important. So we're still able to offer appointments while we have to, in this time period, lower the number of people that are in the office at one time. So we are all doing our part to keep everybody safe. And all of you also have your part as well, which is to take all of the precautions, as Dr. Grotel mentioned. And I wanted to make sure, one thing before I forget, to follow up on what Dr. Shu said about the Nexplanon. If you do not have your access to your birth control anymore, or let's say that the date has expired on your Nexplanon, always make sure to use a backup method. Condoms, this is something that you can also use a telemedicine visit for, whether it's Nexplanon or whatever the case may be, to get a birth control or a backup method or emergency birth control, emergency contraception if needed.
Okay. So thank you, Dr. Pardo. At this time, our time is up. Unfortunately, we had a great webinar, and we want to thank all of our attendees who joined us tonight, and of course our panelists of experts. Ms. Cornwall, thank you very much. Dr. Kalanko, Dr. Bertel, and Dr. Shu, and of course Dr. Pardo, thank you for you know, providing the time out, for providing this for our community of women and beyond, and letting us know that it is safe to continue our lives in this new normal. If there's any information you want to provide our attendees at this time, an email, contact information, if they should have further information, that would be great.
Yes, thank you for all of our panelists. Thank you, Roxy, again for joining us this evening. Thank you for all of our attendees on the webinar and also on Zoom, and the interaction and the questions. I want to remind that this is just the first of many, and we thank all the support that we have at our institution and department. And this group that you see in front of us, in addition to one of us, Ms. Gladys Christoph, we have making a concerted effort to reach all of you where you are. For all of, and there was actually a question about this in the Facebook Live. Pour toute femme haïtienne, nous là pour aussi, n'a fait un programme semaine prochaine, le 19 juin, pour femmes haïtiennes na Creole. And we'll have more programs after that. So you guys tell us what you want to hear, and we'll bring the expert and make sure to have platforms that all of you guys have access to. And just to share our information, again, you can reach us at womenshealth@downstate.edu. If there's, have any questions, any comments, anything that, any place that you think that we should be, that we are not yet, please feel free to email us if you have any questions specific about your health. And you do not have access to a regular healthcare provider, you can, you know, we're all here for you as well. And the phone number is on the screen, 718-270-7207. You can follow the Downstate social media page. You can email us, as you said, and we'll be back again soon. And thank you all very much for tuning in. Stay well, stay healthy. As we are transitioning, but thankfully it's the summertime and we can enjoy the sun while social distancing.
Thank you, everyone. Please be safe.
Yeah. That's